Important part of identifying and treating an AFE is doing a transthoracic echo as early as possible. This allows you to evaluate for right ventricular failure. If right-sided heart failure is present, then fluid management should be conservative. Excessive fluids will lead to right ventricular dilation because the right ventricle will not be able to empty as a result of the acute increase in pulmonary vascular resistance. So here is a copy of an echo, a normal echo, and you see the right ventricle, the septum, and the left ventricle. Here you see the right ventricle is dilated, the septum is pushed over and is compressing the left ventricle, which has a lot less fluid in it, and this ultimately will lead to decreased cardiac output. And this decrease in cardiac output will also result in more hypotension and hypoxia, creating a vicious cycle. Distension of the right ventricle against the pericardium also causes coronary compression with right ventricular ischemia, making the right-sided heart failure even worse. So in this scenario, it is very important to perform the echo as early as possible so that you can manage fluids, because our initial instinct is to try and administer blood products as soon as possible. We think of an AFE, we think DIC, they're going to bleed to death, and we probably frequently overcompensate with blood products that might not be necessary at that point in the resuscitative measures. As we talked about in the previous slide, right ventricular heart failure creates a vicious cycle. It begins with increased pulmonary vascular resistance, which we know occurs as a result of an amniotic fluid embolus. You get your right ventricular dilation, which causes compression of the left ventricle, resulting in a decrease in cardiac output. And this causes hypoxia and hypotension. And we know that hypoxia and hypotension are both potent stimuli for pulmonary vasoconstriction. And so again, you're creating that vicious cycle, which is very difficult to break. So how can we break that cycle of right-sided heart failure? So first, you want to start norepinephrine to treat the hypotension. Next, you want to start dobutamine and or milrinone to improve right ventricular contraction. These two drugs can potentially dilate the pulmonary vasculature as well, which will reduce right ventricular afterload. And then you want to start pulmonary vasodilators